Hi everyone, my name is Mike Zhu and I will be presenting Team FHIR Hydrant's project for the Intro to Health Informatics class at Georgia Tech. So before I get into the project itself, I wanted to take the chance to thank our project mentor, Dr. Viet Nguyen, who is Technical Director at the Da Vinci Project, an initiative that seeks to help healthcare payers and providers increase interoperability, decrease costs, and improve care through the use of HL7 FHIR standards. So the core of our project is an application that identifies and retrieves the patient information necessary for an insurance coverage decision when a doctor orders tracheostomy supplies for a patient. The response that the physician gets should indicate whether or not the medical supply is likely to be approved by the insurance company given the patient's coverage and his or her medical history. So what is a tracheostomy supply, and what are the challenges that doctors face when they're ordering one for their patients? This is Stephen. He was born with a heart defect that required major surgery. After complications from the procedure, he had breathing problems, and so in order to help him breathe, doctors made an incision in his throat and inserted a tracheostomy tube. Now this isn't the end of the story. Because the tracheostomy tube has to stay in place until long after the surgery itself, Stephen also needs supplies to help him clean and replace parts from the tube. When Stephen's doctor orders these supplies, he's unaware of Stephen's insurance coverage and whether or not the insurance would pay for the supplies. He also doesn't know what kind of documentation and requirements the insurance needs in order to approve the medical supply. This is called prior authorization. The uncertainty that doctors face when they're ordering a supply results in billions of dollars spent each year in administrative costs, just so insurance companies can approve and pay for a procedure. We believe that the solution to this problem lies in better integration between provider software and insurer systems so that doctors can know in real time what they need to show in order to get the insurance company to approve a supply or a procedure. So these are the goals that we started with. We want doctors to be alerted of coverage requirements when they order a tracheostomy supply, and we want this to happen within their regular workflow. We want the insurer to be able to provide a real-time response based on their coverage logic and the patient's data, which they have in the form of claims. We also wanted the patient to have a cost estimate based on their insurance coverage. In order to implement our application, we made use of the CDS hook framework. This consists of two main elements. The first is a provider-facing user interface that would allow a doctor to enter in order information in his EMR system. Once this information is entered, it triggers the CDS hook that passes it on to CDS services, which contain coverage logic as well as the ability to query a FHIR server for information about the patient for which the supply is being ordered. Once all the data is passed through the coverage logic, the CDS service then returns a card that tells the doctor whether the supply is likely to be approved or rejected and what further documentation they would need to provide in order for the insurance to cover that supply. The application is currently being hosted on Georgia Tech's HDAP platform, so let's take a look through a hands-on demo. This is a view that a doctor sees when they are starting to order a tracheostomy supply for a patient. They're able to select the specific diagnosis code that triggered this order. Then they can select the CPT code that corresponds to the supply they're trying to order. If they want, they can also change the quantity of the supply, as well as the period of days that the supply is supposed to last for. The CDS cards that are returned tell us whether the supply is approved or denied and how much the patient has to pay. Let's now take a closer look at the coverage logic. Most supplies have a quantity limit associated with them, stipulated by the insurer. So if I try to order a supply that goes above this quantity, then I should get a denial back. This patient has already had a tracheostomy valve ordered before, and so this order is denied. The insurance coverage also states that only patients who have had tracheostomy procedures can get tracheostomy supplies. Now, the patient that we were working with before, 14126, has had a tracheostomy procedure, but this patient hasn't. So when I order any supply, I should get a denial back. This project required that the team learn a number of new concepts as well as programming frameworks, and every member contributed to this effort. Chip and Lee led the effort on the front-end implementation, while Betty, Gio, and I worked on the back end. Addie, our PM, managed the project timeline and also contributed to the repo. We think there's a number of things we can do to improve the project as it currently stands. First, we can conform the front-end interface to Smart on FHIR standards by using the appropriate authorization protocols. In order to scale the project, we would need some way of automating the extraction of coverage logic and elements, perhaps through the use of natural language processing. By using clinical quality language, CQL, for coverage logic, we would better improve the interoperability of our CDS services. And finally, in order to truly test the efficacy and usability of this project, we would need to integrate the implementation with real EMRs and insurer systems.